These are the three things you need to know. First, the Maine CDC is opening 3 new testing locations, and some do not require an appointment. The first is at the Windham Mall. It's open now, Monday through Friday, from 8 in the morning till 4 in the afternoon, but you must make an appointment. The second is in Biddeford. That opens tomorrow. It'll run Monday through Friday from 10 to 4, and again, you must make an appointment. The third is a rapid antigen site at the YMCA in Auburn. That opens on January 31. It'll be open Monday through Thursday from 10 to 2. Appointments at that location are not required, but they are recommended.
I am certainly not going to stand in the way of expanding testing. Getting more people testing in the midst of a surge is what really matters. And whatever that means for the backlog, that is what it means for the backlog. What matters is getting people access to testing and getting them their results. The backlog is not affected by any of that.
Now, the Augusta Armory will continue offering testing on Mondays, Wednesdays, and Fridays from 9 to 3. An appointment is no longer required, but it is recommended. Maine DHHS hopes to announce new free over-the-counter testing options by the end of the week. All right, number 2, hospital staffing. Northern Light Health says 1 out of every 20 staff members is currently out, either with infection from COVID-19 or exposure to the virus. It's now forcing the hospital to adjust how many patients they can care for. During a briefing today, hospital leaders said 618 staff are out. That is a pandemic high. Because of that lack of staffing, leaders had to cut down the number of beds open for non-COVID patients in departments such as orthopedics, surgery, and respiratory and oncology at Eastern Maine Medical Center. The hospital is still taking new patients in those areas, but they're also trying to be aware of preventing the spread of COVID to patients in those other areas of the hospital.
And at times, it is appropriate that beds be not filled if there aren't appropriate staff to provide care for new or additional patients into those areas.
Because obviously we can't be commingling people who are positive for COVID-19 and those who are not.
Hospital system leaders say 60% of its staff are boosted. Doctors say getting a booster is critical in preventing severe breakthrough infections. And number 3, the medicines we have to treat COVID-19 in Maine are in varying supply. The FDA recently expanded the use of remdesivir, which allows Maine doctors to treat more people in hopes of limiting how severely sick they get with COVID and keeping them out of the hospital if possible. As for monoclonal antibodies, there is only one kind that treats the Omicron variant. It's called sotrovimab. Governor Mills called the White House previously and asked for them to increase the supply coming to Maine, which the White House did by double. But doctors say it is still in short supply compared to the people who need it.
The oral antivirals molnupiravir and Paxlovid are also in limited supply and must be obtained via prescription. Currently, availability is limited to Hannaford and Walmart Sam's Club pharmacies. Northern Light Health looks forward to offering these treatments directly as well when supplies are made available.
Now, because of the shortage, Northern Light Health is prioritizing requests for these treatments by the patient's risk of hospitalization or death. And patients should check to see if these treatments are covered by their insurance. In some cases, they are not. Maine DHHS says they're exploring how Maine could help cover some of these treatments, like remdesivir. Those are the 3 things you need to know right now.